about this Still's disease.
Now,
it's in your website.
Yeah, Still's disease. Now, the arthritis in children, juvenile idiopathic arthritis is divided into, there are 7 types.
Yes.
Now, there's a type which is unique. It's called systemic onset juvenile idiopathic arthritis. This one presents with systemic symptoms and signs like fever. There's a fever which is persistent on a daily basis to the extent of 39 degrees and above, degrees centigrade and above, persistent on a daily basis for something at least 2 weeks for you to start suspecting. So fever is a prominent feature of systemic onset, so that when things come with fever, then most of the times people rush to infections.
Yeah, of course.
So the interesting part of it is this fever is accompanied by things like sore throat. So again, even the more people will think about a throat infection causing fever. So you are completely driven out of line. Then, so you'll have fever, you'll have the sore throat, there's a skin rash, which is fleeting. It comes and goes. Kind of like a pink skin rash, which comes and goes. That also associated with the fever. Then you have aching of the muscles. A lot of aching of the muscles. The joint may also ache, and there may be arthritis or just joint pain. When you have joint pain without swelling, or the pain is not aggravated by movement, then that joint pain is called arthralgia, it's not arthritis. So sometimes in juvenile systemic onset, you may just have joint pains, or you may have real arthritis.
And here we're talking about the age group.
0 to 5 mostly.
0 to 5 mostly.
Yes, 0 to 5 mostly. Those are the ones which are attacked by systemic.
Ooh. Yeah.
So the systemic one will affect internal organs, so that it can affect the heart. You will find inflammation around the heart. It can cause inflammation around the lungs. It can give you swollen lymph nodes, so that you may even think of cancer again, or infection again, like TB, because sometimes again it may bring fluid around water around the heart, water in the chest around the lungs, with fever and lymph nodes. Again, somebody will think about TB. The liver and the spleen may be enlarged, those ones. So you may think about infections. When you do investigations again, you will find the white blood cells are very high. So somebody may also think about, again, malignancy, cancer, or infection. It is still driving you off. Yes. So that if you don't have the right orientation in your mind of what could be going on, then you can be completely mistaken. And so it is this systemic onset juvenile arthritis is also called Still's disease. Yes. But now it can also present, this type can present beyond age 16. Now when it presents beyond age 16, if you get an 18-year-old presenting like this, you get a 20-year-old presenting like this, that one now is called adult onset Still's disease, with the same similar features. Similar features. Yes.
It's just that now
the age is beyond age 16. Onset is beyond age 16. But when the systemic onsets, juvenile arthritis, which is a Still's disease, onset is mostly 0 to 5.
0 to 5.
Yeah. It's age 0 to 16, but the commonest age group is around 0 to 5. Mm-hmm. Yeah.
So in your own opinion, let me ask you, what do you think are the right questions a parent should ask? Because he's a child who is 0 to 5 years. Mm-hmm. He's unwell, experiences these high fevers.
Yes. Maybe somewhere in a dispensary in a remote area.
Yeah, so
They'll treat for infections until nothing happens.
So the issue would be persistence of the fever.
Yes.
If
Persistence
it's
of the-
treated and it's not changing, you need to seek for more help.
Yeah, you need to seek for more help. Yeah. Or if you have investigated and you don't find what is causing those things, like you have looked for cancer, you've looked for infection, and you're not finding, then you refer the patient to the rheumatologist.
So you really have to not, you have to be very aggressive as a parent to be determined to get the cure, because it looks like you can get to a point where you give up, especially with the kind of, maybe you're saying the public hospitals don't have this equipment to test for this.
Yeah.
So you can easily give up as a parent.
You may give up, but the thing is, with good information from because the parent, the responsibility of a parent is to recognize that my child is sick,
Yes.
and take the child for medical
care,
attention.
Yes.
So the rest of it actually is the medical system.
Yes.
Yes, not the parent anymore. A parent, once they have taken their child to the medical facility, their responsibility now will be what they have been directed to do from the medical facility. So what we need to focus on is, as much as we focus on the public to seek medical attention, we need to prepare the medical profession to be able to recognize and deal with, or recognize and refer. When you recognize and it is something you can deal with competently, deal with it. When you recognize and something you cannot deal with competently, refer. Because there are many people who recognize things, but they don't refer them to the correct place where they're supposed to refer them. So you should be able to recognize and refer.
Talking about referring, would you say that in Kenya, the rapport between doctors and the network is good to catalyze the referrals? Can effectively refer a patient? I don't know whether you get it.
Yeah, but you see, doctors are among the most educated people. They don't call themselves learned colleagues, but I think they are more learned than most people. So, as getting a place to refer a patient, if you don't have another system, Google is there.
Yes.
Yes. Majority of the patients I see are not referred. The majority of the patients I see have a problem. They have been seeing a particular provider, and nothing is changing. So they ask, and they are told, look for somebody who deals with this disease, and they are told it's called a rheumatologist. They go and Google
and find you.
Yes, and find me or find another person. That's how bad we are.
So that's how bad you are.
Yes.
Yeah, that's what I'm talking about.
Yeah. So it's not that the doctors, what I'm trying to tell you is not that the doctors cannot refer. If a patient can refer themselves, how can doctors not be able to find one another? First of all, we train in the same place here.
Yeah.
And I think apart from one person, the rest of the people have trained them. So they should know that I'm there. And even if I don't talk about myself, there are other doctors who train people. Okay? If we are talking about the system.
I'm talking about the system.
The system, we train in Kenya here, there are particular trainers at the university.
Yes.
Yeah. So they exist. The thing is, how do I find them?
Yeah.
Yeah.
Yeah, and I think maybe, I don't know, maybe this.
And in fact, it's just the rheumatologists who are few, because the others, they don't even need to be trainers. The others are all over the place.
Oh, like we talked about last time.
Yeah.
With this doctor from Uganda, he's the one who began this.
Yeah, Dr. Wankia.
Yes, Wankia. So it wasn't there before, or there was no pioneer.
The-
But now that we are getting, maybe there is more awareness that we need still to create.
There's not exactly so much awareness.
It's not exactly so much.
No. I think the awareness is too little. Too little. That's why thinking that, even the situation of lockdown took so many people online.
Yes.
And now,
Thankfully.
and this is one of the things now why we are doing this, so that other people can be able to access the information, even to know how much we lack the information. Yeah, because everybody has a phone, almost every adult.
Yeah.
Almost every adult. A phone is something which is spread to every part of Kenya.
Yeah.
And these people, they are on social media. They watch a lot of things on YouTube. Yeah, so if we could be able to get this across, then it would reach so
many people.
it would be a good way, modality of spreading the information to others. Yeah,
Okay.
to know that arthritis can affect children.